Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Well, Jennifer, thank you for joining me on Here for Good.
Thanks for having me. Super excited.
Well, tell me about, now I want to make sure I get this right. It's the Rowan Integrated Special Needs Center.
Yes,
right?
It's the Rowan-Virtua Regionally Integrated Special Needs Center.
That's a mouthful. That is just way too much. Is there sort of an acronym or a shortened version of that?
So we fondly call it the RISN Center.
Okay, well, we'll talk about the RISN Center. Tell me about your role.
I am the medical director. I am a med-peds physician, so that means I'm a pediatrician and an internist. And that helps me bring patients who are leaving the pediatric system across the border to the adult system. And it really allows me to understand both sides. And we are a primary care practice for people with intellectual, developmental, and physical disabilities and their families, because a lot of our families need to go to a lot of appointments with their loved one. And so we provide primary care for them as well.
So I would think that a lot of people don't really process the fact that special needs kids grow into special need adults and may require care differently than the masses. Is that correct?
That's absolutely correct. We like to think that they still require the same care that their moms and dads and siblings get or need. Certainly, when we're talking about routine preventative health care, everyone needs that same access, but they need it in a different way.
Would it be special competencies that a clinician or provider needs in order to provide that equal care?
I think it's just human care.
Okay.
But I do think that there are some caveats to learning how to interact with people with different abilities. Some of our patients don't use words to communicate. So how do you interact? Pediatricians know that well. Babies don't talk to you either. They can't tell you all their symptoms, but some of our patients who are on the autism spectrum or even with cerebral palsy don't use words to communicate. So it does interact differently.
What point in your life did you realize that you had a passion for taking care of adults with special needs?
I've always, I think, wanted to do that, but I don't know that I would say that I had a path that I was going to be a physician doing this work. I had a family friend. He was born with a congenital heart problem. His heart was outside of his body. He was the first survivor of the surgery at CHOP, and I used to go to birthday parties at CHOP. And as he grew up, I grew up with him. His dad used to let me suction his trach.
Really?
He also didn't use words to communicate, so I learned sign language. He now speaks. We're still family friends. I had the privilege of becoming his physician as well because...
Do you still know sign language?
I still do, yeah.
Really?
And we just started a sign language club at Rowan SOM.
I know also that in your program, you use the term medical home. Describe or maybe sort of help our audience understand how that either came to be or the importance of it.
What's challenging for our patient population, especially when they have unique needs, is they have to get care outside of their medical neighborhood, which is frustrating. They have to take multiple buses to get across the bridge to get care. And we wanted people to have a medical home in their own neighborhood. So it's really important that people have continuity so that people understand their needs and that they'll advocate for them. So when my patients go to the hospital, I call in advance because I think people need to know what their special needs are and be prepared to help it be an easier process.
I've heard you in other environments speak about creating a foundation, a bridge, a path. Tell me what that really means.
It means that we have people around us learning how to take care of people with different abilities and making their journey as comfortable and as special as they are. And that means that when they're ready to leave a system, that we have easier handoffs. So we have prepared documents that make it easier, that we have an understanding that we will have accommodations when they show up, and it won't seem that everyone has to do something special when they arrive because we're already ready.
Are there many programs like this in New Jersey?
We're the only primary care practice for people with intellectual and developmental disabilities. There are other consultative services and some hospital-based models for this care in New Jersey, and we're really working on building a consortium because there's so many people who have this need. And that's why with our HRSA grant, we're trying to further educate both residents and students about providing care for this patient population so that we don't have to have special programs for them so they can go anywhere and get care.
Yeah. Has the collaboration between Virtua and Rowan, has that influenced your practice, or has that influenced how we're able to do exactly what you just said?
So we've already seen some successes with that partnership.
How do you define that success?
Access. All of our patients need access to routine preventative care. Some of them require sedation in order to access that care. A lot of them require that access or sedation for dental work, and our dentists go to Virtua and provide care. So we've now been able to collaborate with multiple partners so that when they get sedated, they get multiple access points: women's health, dental, ophthalmology, eye exams, blood work, vaccines, anything that they might need if one of our patients require that highest level of care. We hope that we can not need that. So we have embedded behavioral health in our RISN practice, and that helps prepare people for not needing sedation. So really helping reduce the medical trauma they've been exposed to in the past. So getting held down for things, and now we use meditation, or we actually have them develop their own access plan, what they need.
You know, you've inspired me to expand my narrative because I find myself often speaking about health equity. And when we talk about health equity, historically, it's been based on other factors such as race and ethnicity, socioeconomic status, lack of transportation, but you're talking about yet another portion of our population that needs to be access, is one of the key things in terms of addressing health equity. And so now I feel inspired to sort of add that to my narrative to talk about our special need adults. What would you want others to take away from this brief conversation?
So health equity and access are exactly what we're hoping people will take away for especially the patients that we serve. Our patients actually fit in every one of those marginalized patient populations, and they have a disability. So it exponentially shows that we need to work on our health equity access for people with different abilities. And really, people can join the disability population at any point in their lives. So we have a lot of patients with traumatic brain injury, with anoxic brain injury from their heart attacks, strokes. And so our model really serves a lot of people. And the way I think about it, especially since we're coming off of the snow season, is if we clear the ramp first, then everyone has access to getting in the door for our health. And then we'll work on the steps for the able-bodied people.
The first time I saw something of this nature truly at work was during COVID, when we had the mega clinics giving vaccines, and we had a number of special needs kids that we had to create a different environment for them to get their vaccination. And I felt proud that our organization went that extra step to provide what our community truly needed. I'm equally as proud now knowing that we have taken that to the adults. That type of, thinking and making an opportunity where perhaps there was none. I know you do a lot clinically. What about Jennifer when she's not working, when she's not taking care of some of our special needs patients. Well, tell me a little bit about your life
Sure.
outside of medicine.
So I'm a mom of two boys.
How old?
They are 17 and 19. So my oldest is a freshman at Rowan University. So I'm now experiencing it from the mom version of the university. And then my son Aiden, so that's Evan, and my son Aiden is a junior. He's in ROTC, and he's looking forward to going to Rowan for engineering.
Both engineering or what?
No, Evan's going for business. So I didn't quite get people going into healthcare, but Aiden wants to do biomedical engineering. So I think I influenced him a little bit.
Listen, this has truly been a pleasure. Thank you for everything that you're doing such that we can be here for good and taking care of our special needs patients.
Thank you.
It's been a real pleasure speaking with Jennifer regarding our special need patients and how we are doing our best to take care of them. So tune in next time for another great episode of Here for Good.